Here we go.
Okay, well, I'm going to give a little background on Dr. Lisa Konick, a licensed clinical psychologist and founder of Konick and Associates, a quality provider of family behavioral health and psychological assessment services with locations in both Naperville and Orland Park. Dr. Konick specializes in developmental psychology, parenting, neurodiverse conditions. She has expertise treating a range of behavioral health issues, including autism, ADHD, anxiety, depression, and disruptive behaviors in children, teens, and adults. Dr. Konick is known for comprehensive neurological and diagnostic assessments, as well as behavioral strategies grounded in research. Dr. Konick values a multidisciplinary, research-based approach to behavioral health care and is trusted resource within the clinical and educational communities. Quite a bio.
Yeah, thanks, Lori. And I appreciate that. And I appreciate being invited to speak with you all today on anxiety. I know that it is certainly a topic that a lot of people have on their mind, especially as a lot of us are sending kids back to school. There's been a lot going on, and a lot of our clients have been, we see kids as young as 3 and 4, all the way across the lifespan into adulthood. And anxiety is something that we are dealing with at the practice level on a regular basis. And it's also something that we all experience. So I'm going to talk about understanding anxiety in your child and hopefully what you can do about it. And, I'm going to try to watch my time here, Lori. So could you give me a clue, like when we're maybe halfway through, or I have about 30 minutes or 40 minutes of discussion here. So if I take too long, please, I want to be able to have people ask questions as well.
Okay.
So what I'm hoping to do for you ladies today is defining anxiety and talking about the different types of anxiety disorders that you may see in your child, how to recognize those symptoms, discuss a little bit about the difference between everyday anxiety and what we would consider clinical anxiety, which is when you may need to see a professional for support, what you can do to support your child. I want to talk about the different types of treatments that are best indicated for anxiety related disorders. And then I will give you some resources, which I will also share with Lori, and she can get to you books and some apps and wonderful resources that you can use at home. So interestingly, I put this presentation together for a school prior to COVID. And at that time, nearly 1 in 3 of all teens ages 13 to 18 were experiencing an anxiety disorder, which is a fair amount of kids. I mean, you probably have 3 kids at your house on any given day, and one of them's probably experiencing stress, if that stat is correct. And some of the factors, this may actually be a little higher now with COVID and post-COVID. So some of the things that contribute to children, and this was, we're focusing on teens, but also kids that fall into this too, regardless of the age of your child. So we live in a high achievement-based culture. So kids have a lot more pressure than I think they used to achieve and know what they're going to be doing. And they think that they have to have their whole career laid out for them when they graduate high school, and they know what degree they're going to get and all that. So there's a lot of achievement-focused and achievement-based stress in our youth. We also have a world that feels very scary and threatening to children and teens. We have lockdown drills, we have public safety, we've had civil unrest, we've had the pandemic. So a lot of these factors are very stressful for not only parents, but also for their kids. Social media is a contributor. It can be very helpful, but it also can be difficult for kids due to social comparisons. They're constantly connected, they get immediate information, and it may not always be accurate, and they may not be able to sort through what's accurate and what's inaccurate. Anxiety is the sense that we all have. It's the fear of being, it's worry, it's nervousness, and it's the fear of something that's imminent. So something that's coming up that we are uncertain about. And we all feel anxiety when we have just general events that are coming up, fear of a test, fear of a job interview, things of that nature. So these can be functional because they can be motivating. If you have a little bit of anxiety, you're motivated to do well, you're motivated to study, to prepare, but it can be dysfunctional. So I'm going to talk a little bit about a couple of where it starts to teeter into dysfunction. And that's when we have what's, so these are, I'm going to go through these terms for you briefly. Generalized anxiety would be that persistent and excessive worry about everything. You have the kid that says, what if mom, what if this happens? What's the worst thing that would happen? And then they kind of build that roller coaster of anxiety over things. Typically about routine issues, but excessive worry about regular things. Separation anxiety is what we see more often in younger children. It's fear of being separated from a caregiver. And that can translate as kids get older into what's considered social anxiety. So social anxiety would be fear of embarrassment, fear of being judged or evaluated negatively by others. And a lot of people that have social anxiety may be afraid to go to places without their comfort person. So a friend, a parent. So that's where that separation anxiety can transfer. Panic is a disorder that we see a lot in individuals where there's a lot of physiological symptoms. So they're getting those peak symptoms. It usually comes out of the blue, and situations are then feared. And there's a lot of avoidance behavior as related to being fearful of having a panic attack in public. Anticipatory anxiety and test anxiety are not necessarily disorders, but they're terms that we use a lot to describe fear of worrying about something bad that might happen. That's anticipation. And we have that generally when we're preparing for something, you know, a presentation, a job interview, like I said, we anticipate, but it can be so excessive for some people that they avoid situations, and then the avoidance becomes a problem, such as school refusal or school avoidance. Test anxiety is similar, but it's going to be very specific to your mind going blank when you take a test, and that can interfere with academic performance. So I have a slide here that shows different types of the ways we experience anxiety. And the interesting thing about this is there's multiple components of anxiety. So we have the physiological or the physical bodily aspects of anxiety, which many of us refer to as that fight-flight response. When our physical body starts to, our heart pounding, dry mouth, stomach aches, we'll see tummy aches in a lot of younger kids, headaches. And a lot of times these are avoidance-based behaviors because we don't want to go to school and we don't feel good. Psychological symptoms of anxiety are going to be more the mental processes. So the racing thoughts, excessive worry, moody issues, nightmares, your mind going blank. And the behavioral aspects of anxiety are more of the things that people do to deal with their anxiety, such as avoidance, escape behaviors, obsessive compulsive rituals we may see. So the interesting thing about this anxiety triad here is one of the things that we tend to do, and I'll talk about this when we talk about treatment, is we really need to address all three of these areas to be effective. What's happening is a good question in anxiety, and I'm going to relate this to what might be going on with your child in terms of how do you recognize these symptoms. So physiologically, we go through a fight, flight, freeze response. And these are our body's safety mechanisms to protect us from a real or perceived threat or danger. Unfortunately, with anxiety, a lot of the things we may be dealing with are not dangerous. A test is not dangerous. A lockdown might be. So our kids are being exposed to different things, but the body reacts to something that it perceives as a real or perceived threat, even when there may not be a threat. And we have to look at these different aspects of the fight-flight response physiologically because it's extremely uncomfortable. And what we want to do is get out of that situation. The other piece is the freeze response, which is when your mind goes blank and you just freeze. And if we think about where this comes from, it's very rudimentary. It comes from our early hunting and gathering days where you either have to fight a perceived threat, you freeze to hide, or you flee to run away. So your body's doing this. The other piece that's challenging and maybe more prominent for some kids, especially teens in school, is the negativity bias. And this is that negative dialogue that we have in terms of our self-talk that can actually activate the fight, flight, freeze response. So these are natural occurrences of how we deal with stress and danger in our environment. And I mentioned it can be triggered by both real or imaginary threats. And even though it happens automatically, and if you've ever been startled and you feel that kind of rush of adrenaline and that heart racing, and then you realize, oh, that was just, you know, a squirrel in the backyard, it actually activates, and it has to go through the whole process before it stops. And we can have these responses even when the threat is not an accurate threat. So what that means is we're responding even when there isn't a danger to us. And some of the things you might notice in your kids when it comes to these reactions is, I think a lot of times kids are getting misinterpreted for their anger reactions. So our kids don't always have the skills to deal with these anxiety reactions or their stress in their life. So you may see signs such as aggressive outbursts, physical aggression, verbal aggression, irritability. Those could be signs. If you see these come on, and there happens to be some stress or a major life change in your child, these could be signs of anxiety or stress. The other aspect of that would be the opposite: avoidance, procrastination, increased sleepiness, isolation, escaping situations that are uncomfortable, avoiding going to places that other friends might be at. And we've seen a lot of these behaviors post-COVID because kids have become so isolated that they're anxious about being around others. The other piece, where the cognitive piece, is that fear that my mind is going blank, I'm inattentive, I'm forgetful. So these are all signs that people may react to as parents punitively, or get frustrated with your kids. You're not doing well, you're not focused in school, and they could actually be sources of stress. I talk about a few of these other ones here. Difficulty sleeping is another one that we see. Having problems falling asleep, staying asleep, bad dreams, irregularities in sleep, increases in defiance. The chandeliering effect, which is that kid that's usually kind of calm and all of a sudden starts to have these moody outbursts for no apparent reason. Having difficulty focusing, poor attention, versus the opposite, which is the over planners. Some kids are overly planned and they have everything organized because they don't want to have any ball drops. And then negativity. So having a lot of negative thoughts, maybe self-derogation. So far, does anyone have any questions? I know I'm kind of going through this fast, and I apologize trying to make up time that we lost in the beginning. I'm going to keep going with these because this is an interesting slide here that I think a lot of people have questions about. How do I know the difference between everyday anxiety in my kid that's typical and understandable versus whether or not I should seek some support because my kid may be struggling with something more? So I'm going to look at these two comparisons for you. Everyday anxiety, so thinking about what is in their daily life, worrying about school, worrying about a test, worrying about getting a job, there's an important event, and you have some general stress, but after the event's over, your child is kind of back to their regular self. That would be an understandable amount of anxiety. However, if you are seeing your child having constant, unsubstantiated worry, significant distress, physical symptoms, lots of avoidance, pervasive challenges across multiple areas, and they're not really managing well, they're not sleeping for weeks, then we probably are looking at something that's more concerning and could be the sign of an anxiety disorder. Another area that we see, kids, this is more of a social anxiety question, embarrassment or feeling self-conscious after something awkward happened. We saw a lot of reentry anxiety with kids back into school because they hadn't been around people for almost a year, and they didn't know how to talk to some of these peers they haven't seen for a while. That's understandable. And once, I usually say after about a week, you should see this subside. If it continues after several weeks, a month, then we may be dealing with a bigger issue. So if the child is still avoiding after being exposed to those individuals or that situation, and they're still feeling a lot of excess anxiety about being judged, embarrassed, humiliated, when it's not really an accurate, or it's over exaggeration of the situation, then we're probably seeing something more concerning. Having a case of nerves before a test, a presentation, being on stage, doing something where we're going to be evaluated, and having some stress prior to that. And then what we would consider anticipatory anxiety, understandable. And then we would see that kind of wave of anxiety reduce after the event passes, is understandable and expected. But if your child is having a lot of physiological symptoms, what we would call a lot of times panic or anxiety, heart racing, feeling flush, feeling sweaty on the floor, feeling like they're going to flee a situation, then they may be having something more significant that would require an intervention. Having a realistic fear of something that's dangerous, snakes, heights, understandable. But if they're significantly avoiding situations that are not really threatening, then we may have a bigger problem. And then finally, when we talk about a traumatic event, a sad event, an adverse life event of some situational occurrence, we would want to see, we would expect to see some sadness, some difficulty sleeping, some stress after that. But if it is happening months or years after the event has passed, then there may be a notable response that requires intervention there as well. So parents want to know often in our practice, what should they do when they are supporting, how do they support their kids at home? So in our practice, we work with kids, but we also work with parents. We want to have the kids learn skills, but we want their parents to also learn those skills. So they're working together, and even teachers having the school support be all encompassing so that these kids are getting the supports that they need. So one of the things I often will do is we work with kids to come up with what do they feel like they need and what are some tools that they can use. And I'll go over that a little bit more in a minute, but also how do parents support the kids at home? So one of the things we want you to do is talk to your kids about potential stressors in the world. Try to see the world the way they do. Some of the things that might be very stressful for a kid or an adolescent may not seem as stressful for you as a parent because you've already navigated that, but their world is very socially focused. And so there tends to be some catastrophizing of maybe events more so with a limited life experience and limited skills with which to cope with those experiences. So we try to work with them to not minimize, excuse me, because saying, you know, that's not a big deal, you'll get over that quickly is not a helpful response, but seeing that as a perspective of, that sounds like that's really bothering you. That sounds like you're really concerned about this. What are some things we can do to help manage this situation? So we're working on it together. The other thing to do is to model positive stress management strategies with your child. We're very behavioral. So we model tools, we teach tools to regulate. So we talked about the physiological, the behavioral, as well as the physiological symptoms. We want to be able to manage all three of those. So for the physical symptoms, deep breathing exercises, progressive muscle relaxation are ways to kind of decompress that flight-fight response. And so we want to teach and model those. We want to work on cognitive reframing to work on those mental or thought processes that may not be accurate. And we also want to reduce avoidance of stressful situations by doing what we consider graduated exposure. So I know you're stressed about going to school. What supports do we need to go into school so that you're not afraid to go? And the more we're doing those things and getting the team approach, the more helpful it'll be for the kids. The other thing that's important, and I talk a lot to parents about, is what are the expectations that we're setting for kids, and are they realistic ones? So we want to kind of have that balance between, we want our kids to reach their fullest potential, but we also want to scaffold those skills. They're going to be more successful and more productive if they are able to scaffold into those areas to reach their potential. And we talk a lot about the value of failure. Kids are generally terrified to fail right now in this world that we live in. They're very academic and achievement focused, and they're afraid of making mistakes. We have a lot of perfectionists in our office, and we also don't want them to give up because they're afraid to fail and they don't want to experience that sense of failure. And we talk about how do you allow your child to fail in a way that we can teach natural consequences and learning from mistakes. So, and I use a lot of scenarios about how we make mistakes in life. You didn't just get up on and ride a bike. You actually had to learn how to balance. You might have fallen down a few times, but you persevered and you kept trying. And as you continued to develop those skills, you were able to be more successful. And we use that in different scenarios to help our kids understand that failure is a process of learning, and we can work together to making mistakes shows that you're trying. The other thing is balance. Kids need time to learn how to relax, how to play, how to be with their friends, and it's really beneficial for their mental and their physical health to have balance. So teaching good time management skills and teaching how to use downtime effectively is something that can be very valuable for them. The other piece that we see a lot of kids get very stressed about is social media. Social media can be great. It's a great way to keep in touch with each other, especially when we're distanced, but it also bombards them with a lot of, it can be negative information and it can be misused. So I always encourage parents to talk to their kids about their social media use. And if their social media is making them stressed, a lot of times they'll tell me, I just see all my friends on social media and I didn't get invited and I'm feeling lonely, I'm feeling excluded. We talk about that, and we encourage parents to talk to their kids about how they're using their social media. And ideally, can they make the decision to take those breaks from those individuals rather than feeling like you're in charge of telling them how to manage their social media or their phones. One of the things we like to do in my practice is to teach kids, give kids tools to manage their stress and their anxiety. And we want parents to help be able to solidify those tools as well. And the tools that might help you as a parent may not be the same tools that your kids are finding most effective. So we really like to have a nice toolbox available to them. Sometimes we call it a coping list, but generally there's lots of ways that we can manage stress. And it depends on where you are focusing your stress in your body. And are you more of a physical stress carrier? Are you a mental stress carrier? Are you a combination of both? So some of the things that are quite effective for stress management, and this is more preventive rather than reactive for stress management, is thinking about the things we do to decompress on a daily basis. Is your child getting enough physical activity? And that doesn't have to be sports. It doesn't have to be running or biking. It can be stretching. It could be just moving around, taking a walk the dog. So physical activity is a very important part of regulating the physiological aspects of stress and giving our muscles a break from the tension. Relaxation is another alternative. If you don't have a physically active kid, you might have a kid that we're looking at different ways to relax. The other piece that we think about for the brain part of the stress, the mental process, is mindfulness. So stress and anxiety, in order to manage that, we want to be in control of things. And we also fear and worry a lot about the future. Anxiety is generally future focused. Mindfulness is a way of being present in the moment. And it helps us to focus on the things that we are in control of right now, today. So for example, a case scenario that I hear from kids is, I missed my homework assignment. I'm gonna fail the test. I'm gonna flunk out of high school. I'm never gonna get in a good college. And then I'll never have a job and I'll probably be, homeless. Well, that's got a long string from a very minor event. So we try to be mindful and bring back into the moment, well, do you have control over the homework? And then maybe we need to do some organizational supports. Maybe we need to talk to a teacher. So we're problem solving in this moment that we have control of today. And it really helps kids to backtrack a bit. The other part that we can look at for managing stress is taking time away, taking a break. That's that brain break. You only do so much work in a day, and then maybe you do need some downtime, and then pick it up again tomorrow. And that can give our brain some time to process information and recover. Positivity and gratitude are another very helpful ways. And I talk about cognitive reframing in our work. So we're looking at that negative track of thinking. You know, I talked about the worst case scenario situation that leads us to being homeless. We also have a lot of negative self-talk. Approximately, I did a talk recently, and one of the speakers had indicated that about 95% of our self-talk is negative. And that's quite a lot of negativity. So we're doing something around the house, you drop something, you're like, oh, that was stupid. If we're doing that all day, it's really, we're pushing against something that is quite negative. So really taking those times to be positive. I usually encourage kids to maybe journal or have a gratitude journal, thinking about the things that have happened in their day that they're actually good at. So when they do have a stressor and they do feel negative, they can go back and look at the things that they're doing well. Creativity is another way to broaden and give ourselves a break and find positive things about ourselves that we like and enjoy. I talked about cognitive reframing of negative thoughts, and then also teaching good planning and problem solving skills, which hopefully we can foster positive communication relationships between parents and kids, parents and teachers, and that way they can be more effective problem solvers because they'll have people they can go to get support. Any questions so far as we're going through this? I don't see everybody's faces, so I'm having a hard time regulating here where we are. So Lori, if we have questions, please feel free to bring those up to me as we're moving through this. One of the reasons why I think it's extremely important that we work on managing anxiety and teaching and practicing good anxiety management strategies is anxiety can have a lot of complications. And kids aren't always thinking about these complications, but parents, you may know, you may have family members that experience some of these. So worry is more, it is more than just worrying. So we look at what can long-term anxiety do to the body? Well, we can have long-term anxiety can foster depressive symptoms, which can often co-occur. It can also be correlated with other mental health disorders. Unfortunately, people that don't develop strong coping strategies for anxiety can start to misuse substances and get involved in substance abuse problems. It can lead to sleep disorders such as insomnia, which can then create other problems with focus, attention, and being successful in things that you're wanting to do in life. We can have long-term digestive problems, headaches, chronic pain. We know that there's problems associated with social isolation, problems functioning at school and work, quality of life, and suicidal thoughts and actions. So we really do want to make sure that we are coping well with stress. So if your child or yourself or someone you care about is experiencing stress and anxiety, and you are thinking more about, after hearing some of these discussion points, that you're wondering, what should I do next? I am concerned that my kid might be struggling more than I can help them with. Some of the things that we ask you to kind of reflect on is, if you're worrying too much and it's interfering with your life, quality of life. So is it interfering with my school, my work, my relationships? Is it so upsetting to me that it's difficult to control? If you're stressed more often than not, then that's probably an imbalance. If you're also having problems with your mood, you're feeling depressed, you're struggling with drug or alcohol use, or you have other concerns related to that, problems with attention that you need to sort out, because your anxiety is actually deflecting or taking over your ability to focus on things that are important in your life. If it's related to physical health problems, and in these cases, obviously, if there's suicidal thoughts or behaviors, you will want to have that person seek help immediately, at least for an evaluation or a consultation. So we have some screening tools that are available. They're free tools online on psychology-tools.com. There's a link on our website as well. And these are not diagnostic, so there's lots of them on there on psychology-tools.com. They're good resources to do a screener. So there are some depression and anxiety screeners on there for adults and for kids and for teens that are really quick. It's anonymous. You get a quick result and it'll tell you the severity level of your stress, your anxiety, your mood. And if it's high, you might want to talk to somebody. And I want to go through what types of treatment should we be considering if we are concerned about an anxiety disorder. We are very research-based in my practice, so I've listed some research-based methods that have been proven in the research to be effective to support and manage anxiety as well as depression. And these are based on looking at all three components, so both the physiological, the cognitive, and the behavioral aspects of anxiety. So cognitive behavioral therapy focuses on all three of those. It's a triad, and it focuses on teaching school tools and relaxation strategies and positive reframing of negative thoughts as a way to work on overcoming anxiety and stress. And it also helps us to expose ourselves to situations in a appropriate way rather than avoid. And as we are exposed to more situations, we're gaining confidence and skill. So there's a lot of skill development techniques in CBT. Acceptance and commitment is kind of an offshoot of that. It's a way of learning how to give up your control and learn how to tolerate distress and also involve yourself in meaningful activities. So they work really well together. DBT is another one that's focusing on the mindfulness and being in the moment, and also working on tolerating stress when I can't do anything about it in this moment. It's also a great strategy for teaching skills to regulate your emotional state. And the other piece that can often work in concert with this is, a medication evaluation by a pediatrician, a physician, or a psychiatrist on whether medications can be an effective adjunct. And a lot of times for meds, the medications such as antidepressants are often prescribed in kids because the anxiety-based medications are typically reserved for adults, but they can help us become more available. They can get the symptoms under control enough for the patient or client to be more available to these other areas of therapeutic treatment. So they work really well together if necessary. So I have listed here some self-help resources. I can share these with Lori. I won't verbally go through all those, but there are a lot of books that can help you and your teen or your child work through. There's workbooks, there's journaling, there's mindfulness techniques that can help you and your teen gain some of these tools independently that are published. You can get them easily on Amazon.
Lisa, I'm going to interrupt really quickly. There are a few questions that have come through in the chat. I don't know if this is a good time you want to address those, or if you want to wait a little bit.
Please do.
Okay, I'll go ahead and read. I'll go through the questions. The first one, when do you support / cater to your child's anxiety, and when do you have them push through? For example, a child's nervous to travel with family or go to a school event.
Very good question. And I think that's a painful one for parents because they don't want to give into the anxiety and enable, but they also don't want to create more anxiety by pushing through. And I do think that that's a tricky one because it's going to be situational. What we will do is we will work on identifying some very specific triggers and trying to understand what is it that is the feared event. So we've had a lot of this with kids re-entering back into school. Lots of kids were stressed about school. And what I tend to do is I talk about what is it about school that's scary. It's not all of school. And for example, one child that I worked with last week discussed it's the crowded areas in the hallways. So if we can identify very specific triggers, we may be able to accommodate those triggers temporarily until we get more exposure and some skills. And we also want to teach in the interim. We don't want to kind of rip the Band-Aid off because then we're kind of naked and afraid. So pushing a kid into a situation without any tools to cope with stress is very overwhelming. So we may do some deep breathing techniques. We may do some positive reframing of negative thoughts in combination with an exposure, which is maybe we could go to school. We'll check in with the school social worker in the morning. For some of our high school or junior high kids, we gave them a temporary passing period where they got to leave the prior class 2 minutes early to reduce that tension in the hallways. So they had that quieter hallway experience, and then they were able to navigate better. And then after a week or so of that, they're good to go. They're not as stressed. So it really has, I hope that example helps to give you an idea of how we can kind of balance those tools and exposures together.
Thank you. The next question was, how do you feel, in your opinion, about social media parental controls for a high school age student?
Good question as well. I think the question's referring to should parents of high school students use parental controls with their kids?
Yes.
And that's a tricky one because it really does depend on the kid. I work with a lot of kids that are neurodiverse. They have a difficulty with social understanding and social interpretations, and they are at risk for being vulnerable and making some pretty poor choices. So in some cases, we want to teach healthy social media use. We want to teach healthy boundaries with people and recognizing when people might be manipulative. With some kids, though, we may need to, if they're obsessive and they have a hard time with mental obsessional fixations, sometimes it is important they may not be mature enough to manage that even in high school. So if you want to talk offline about that, I'm happy to do so.
Okay, the next question is, a parent of a daughter with severe anxiety and depression. I know how difficult it is for her to access the tools to help her, many of which you mentioned here, when she's in the throes of during her anxiety. Can you advise about whether it's important to practice the tools during periods of relative calm and well-being? And does that make them easier to access when they're needed?
It can. And, you know, this is an interesting problem as well, because this is where DBT, just dialectical behavioral therapy, can really help if she's not getting that. The interest in DBT talks about the emotional mind and the rational mind. They kind of intersect with each other. So when our brains are calm, we're good problem solvers. We're able to access rational thought, and we're able to think through situations, which is probably when she's learning those tools in a therapy environment, when she's feeling calm. When we are escalated emotionally, our rational brain shuts off and our emotional brain takes over, and they don't work together very well. And so when we're in that emotional state, unfortunately, I think as a parent myself, we want to fix that problem and kind of reduce that tension and help her. And she may not be able to access those tools when she's in her emotional mind. And that's high anxiety, for example. That's where DBT can come in. The stress tolerance is kind of bringing those two pieces together. So there is some distress that she needs to work through to ride that roller coaster wave of anxiety to the other end. And that's the part that's really hard. And I would encourage you to work with your therapist or someone that's a behavioral specialist to say, when should the parent allow her to struggle and when should we intervene to support? And that's part of her treatment process. And I hope that helps a bit too. Actually, I'm going to talk about apps in a minute, and some of these apps could be helpful for her as well. Gloria, there are more questions?
There are a couple more questions, 2 more questions. Go ahead. When do you involve school in your child's anxiety?
That would depend. I do like to work in collaboration with schools. And if the child is having anxiety related to school, then probably it would be beneficial to work with the school to incorporate some interventions in that area. If it's unrelated to school, it's questionable, because if it's a social issue, it really depends on if the social issues are occurring at school. Having a connection or a consultation with the school psychologist or the school social worker can be very helpful, so that your child has a point person in school if they do become stressed in school. And if they're having challenges with, we're talking about specific techniques, these are things that your child's learning to do, you can help foster those at home, but you can't really help foster those in school. So having the school social worker involved and just saying, these are the things that that we're working on and may be beneficial for them to need support on or have accessible to them in the school setting. Schools are often very welcome to the collaboration, and they want to be involved to help your kid be successful. Okay,
the last question is, how do I help my daughter calm down and try to do deep breathing when she says it does not work. She's 11.
That's always fun because kids do the deep breathing like they're hyperventilating, and they'll go, see, it doesn't work. It doesn't work. And she may not be ready for it. I model it a lot with kids. We practice it, and I teach them the proper way to do deep breathing, which is not hyperventilative breathing. That will actually make you more stressed. And if she doesn't want the deep breathing, then maybe there's some other options. And actually, this is a great transition to our apps. There are some phone apps that are available, and kids like technology, so I'm happy to have them use them. There's ones that you can pay for. There's some that are free. Deep breathing may not be her thing, but there may be another thing to do for her. You know, coloring for kids is very calming, and they have adult coloring books now. They have apps that have coloring on them. We've used Headspace. We've used Dare Break Free. We've used Calm. We've used Colorfly. So some of these techniques are available to kids in the moment, or, excuse me. They're always going to have their phone, so they'll always have these available to them. There's also some progressive muscle relaxation apps that can help with relaxation. Those are probably ones that they're not necessarily going to be doing at school, but they can do at bedtime. The other one that we like are nature sounds. Excuse me, one more second here, ladies. Nature sounds can help with relaxation as well for sleep. And the kids are very savvy about finding ones that they like. So I usually encourage them to explore some of them. Once I give them the direction that there's apps on their phone, they can do the research and they find ones that they like themselves. There's also mood trackers for kids that struggle with mood that some kids like to have, because it talks about when they are feeling a certain way and maybe what some of those triggers might be for that. So it really depends. Finding something that they're willing to use is going to be the most important. That was all I had for today, everyone. If there's any other questions, I'm happy to stay on a little longer. We have our contact information here. If you have any additional questions, feel free to email me or contact us directly through our website. We also have some resources on our website, on our resource page under www.konickandassociates.com. We also post pretty frequently newsworthy articles and information on our Facebook page, which is on Facebook at Konick and Associates. So please feel free to access those resources. We have a newsletter that goes out monthly as well, and you can register for that on our website.
Thanks so much, Lisa. And thank you everyone who joined in.